Welcome to the Heart of Healthcare with Dr. G. This is a podcast that is unafraid to address current issues regarding top healthcare needs and concerns.
Hello, everybody. Welcome to the season finale of At the Heart of Healthcare with Dr. G. This is the culmination of season 1, and I'm calling this Dr. G's season finale pearls. So I wore my pearls for you guys today. They're not real, but they're pearls. So we're just gonna recap the season and go through a pearl from each episode. In medicine, when we have a lecture, when we're preparing for boards and things like that, we always have a clinical pearl from that particular topic. We're not doing necessarily clinical things here. This podcast is for regular people so that you guys can know how to navigate our healthcare system. So it's not clinical pearls, but it's just pearls, we'll just say that. And speaking of boards, I'm also coming off of good news of finding out that I just passed my Hospice Medical Director Certification Board. Woo! So I'm like still vibrating about that. So lots of things to celebrate. 1 year anniversary at this great company. So lots of good things happening, and summer is here. And yeah, that's what the color's about. I was worried that some of you guys wouldn't recognize me on YouTube. So let's just jump right into the season finale pearls. So for episode number 1, we'll call it the pilot. It was entitled, What is Hospice? That H word scares a lot of people. And so with that episode, which I'm very proud of, we were able to have a conversation and discuss what hospice is, how it originated, how it came to the United States, and what you get from it. And so I also in parallel discuss my journey in not really understanding it and rejecting it in my medical education, but I come to find my niche in it. So the pearl from that episode is, what is hospice? The pearl is healthcare, team-based healthcare in your home when you have a life-limiting illness. That's the takeaway. If you don't remember anything else, that's what it is from episode number 1. Episode number 2 is palliative care. What does that word mean anyway? The pearl is a definition. The palliative is a Latin word from pallium, which means cloak. When patients receive palliative care, they are cloaked with care and comfort as they receive highly focused pain and symptom management. So a cloak is like a coat, like my sweater here. So we can consider palliative care an extra layer of support for anyone who has a chronic illness. You're dealing with nephrologists, you're dealing with cardiologists, you're dealing with pulmonologists, you have tons of medications, you're in and out of the hospital. You just need an extra layer of support. And what we do is reduce suffering, manage your symptoms, and help you navigate the healthcare system by coordinating your care with those specialists. So extra layer of support, the cloak. Then we went on to in the season 1, we went on to episode 3. It was entitled Skilled Home Health versus Custodial Care. This one might sound a little harsh, but the pearl is, even though your family members love you, they are not nurses. Don't get mad at me. Let me explain. So I always distinguish the desire a loved one has to take care of their parent, their child, their brother, their sister, from the needs that person may have when they're really ill and really debilitated. In certain illnesses, patients become bedbound. They're susceptible to bed sores and infections. Just a ton of things can happen as the body is shutting down. And at some point you need skilled nursing. And so in that episode, we really distinguished custodial care, that would be caregiving, versus skilled nursing. And so that's something that we talked about. And the skilled nursing you get from home health. And so that leads us right into episode 4, where we talked about how are home health and hospice paid for. And the pearl is Medicare saves the day. So those two things are covered by Medicare. That's a benefit that we get as Americans. It's fairly simple. So that's what we talked about in that episode. And you also get a little bit about my family in that episode. I'll talk about how I came to be Dr. G. Then we're going to move on to episode number 5. The title of that one was Loneliness Because of Illness. And I want to say that backwards. Illness because of loneliness. Because what came first, the chicken or the egg? So the pearl I'd like for you to take away is loneliness can make you sick. Connect with a palliative care team. We mentioned going on to the Get Palliative Care website and putting in your zip code and finding a palliative care team that could help you with your chronic diseases. Connect with your family and friends. We are all in this pandemic. We're still dealing with recovering from that. We just emerged to interact a little more. Now we're probably having to shut down a little bit again. We're just kind of in a tough place right now. So connect on your devices, use your FaceTime, and if you don't have that, then you can connect to great companies like our sponsor here, Destiny Hospice and Palliative Care, where we become your extended family. So there's always someone there to help you. When I visit patients in nursing homes, I can talk to a nurse and they know everyone there. It's just, there's love here for you. So do what you can to reach out, ask for help. We also provided a phone number in there if you feel lonely. So that was episode 5. Episode 6, the title was Pain Management in Hospice Care. The pearl is, there is no barrier in managing your pain when you have a terminal illness. This episode specifically talks about hospice care. The CDC has guidelines for opioid use. I brought up opioids there because that's the cornerstone of pain management in hospice, but there is no barrier when you have a terminal illness, and that's the takeaway from there. And just listen to that episode if you want to hear more about that, because pain is something that's really scary to a lot of people, but there's no barrier when you have a terminal illness. Then we went on to the last episode 7, where we discussed Medicare versus Senior Advantage plans. The pearl there is Medicare only pays for 80%, senior care plans cover more. Now, this is not an insurance show, so I'm not going to get into all that. That stuff gives me a headache. But we just compared and contrast the different plans that are available. You have to make a decision that's best for you and your family. And in your situation, we just discussed the differences between Medicare. We went into Medicare Part A, Part B, Part C, Part D. But the Medicare Advantage is Medicare Part C, and hospice care is under your Medicare Part A. So that's what we talked about. So I actually wore this t-shirt for you guys, Queen of Hearts, because we're at the Heart of Healthcare with Dr. G. I have had so much fun with the team here. I want to give them a round of applause and thank them for all the hard work put into this season. We've had a wonderful time, hopefully giving a great gift to the world, educating the community on navigating this healthcare system. So remember, if you have any questions, reach out to us on social media, leave some comments there wherever you're watching this, on Anchor, Spotify, Apple Podcasts, or on YouTube. And we also have a phone number. Reach out to me on social media. Whatever you want to do, we're always here for you to get you what you need. So thank you guys for your time, and I'm signing off season 1.
Thanks for tuning in to At the Heart of Healthcare with Dr. G. Help us by rating us on iTunes, and don't miss an episode by subscribing on YouTube. And be sure to click that little bell to get notified about new episodes. We can't wait to see you next time.